This is a Fox 13 News special report.
It's not a Republican issue or a Democrat issue. It's a humanitarian issue that affects everyone.
Utah has a problem.
We average one overdose each day in the state of Utah. Over half of those overdoses are right here in Salt Lake County.
Hydrocodone, oxycodone, morphine, and fentanyl are all opioids, a group of drugs commonly used as painkillers. For many years, doctors and dentists have prescribed them to help us manage pain following injuries, operations, and procedures. They are strong and highly addictive. Some people say they were hooked in a matter of days, prompting them to keep going back to medical professionals for more, while others turn to street-level drugs.
Young mothers that have started on an opioid for a painkiller turned into a heroin addiction. They are now on the streets. Their children are in foster care.
The resulting opioid epidemic has affected people from all walks of life. Nationwide, more than 130 people die from opioid overdoses every day. And Utah has been one of the hardest hit states, at times ranking as high as number 7 in deaths per capita.
It's devastating to think about the numbers in terms of human cost.
Thank you for joining us for this Fox 13 News Use Only as Directed special report. I'm Bob Evans.
And I'm Kelly Chapman. Over the next half hour, we're going to look at the steps being taken to keep Utahns from becoming addicted to opioids. Our first guest is here to show us just how severe the opioid crisis is in Utah. Joining us now is Susannah Burt with the Utah Division for Substance Abuse and Mental Health. Thanks for joining us, Susannah.
Thank you for having me.
Susannah, can you tell us how bad is the opioid problem in Utah right now?
Right now? Well, thank you for having me again. But, you know, we used to be at the top 10 in the nation. And unfortunately, at one point, we were even in the top 5. We've thankfully made a lot of progress where we're not in the top 10. We're about 20 right now, but we are seeing our numbers go back up, which is really disheartening. So when we see these opioid deaths occur throughout the state, not just along the Wasatch Front, but through our rural areas, it is really something we see we have to address and we have to change now.
Let's break this down a little bit further, Susannah. Which age categories are most affected, or is this truly a universal problem?
You know, everyone can be affected by addiction, and it isn't one age that's seeing most of the addiction, but we are seeing most of the deaths occur as adults. We are seeing about 7,000 of our students are using and misusing opioid drugs in the past 30 days.
Students meaning
under 18.
Under 18?
Under 18. That's about 70,000 students, and that was in one of the student surveys we did a few years ago. So I think what we're seeing is that we're seeing a change where with alcohol, we would say, oh, if you don't use it until you're 21, you're not likely to become a dependent upon it. And now we're seeing opioids where if you or I were to be given a prescription that was longer than we needed, or we used it or misused it incorrectly, we then can become dependent upon it. And that's where things can start. So our goal is to prevent all of that, to prevent students from misusing, prevent adults. You know, our grandparents, our older adults are also becoming very vulnerable with this. They're prescribed opioids way more than any other age group.
When you think of what's written on a prescription bottle for a painkiller, it doesn't necessarily say opioid on it.
Correct.
So what kind of drugs are opioids, and what should we look for on that label?
That's a great question. Start looking at if it's a painkiller. If they're giving you something like tramadol, which isn't normally seen as like a painkiller, it's something to help alleviate some of our back pain or chronic issues. You've got Percocet, Lortab, hydrocodone, oxycodone. Those are all opioids. And unfortunately, or fortunately, our body doesn't know the difference between that and what is a more commonly known opioid of heroin. So they're the same thing.
What do people do then, Susannah? People that are in severe pain or have medical issues, where do they turn?
Well, you have a lot of alternatives to begin with. So instead of going right to the opioid or right to a painkiller, looking at physical therapy, looking at icing, looking at yoga, which sounds bizarre, but it is helping us stretch out. I just spent all day at FanX, and if you think about what you're wearing and walking the floor, they actually had someone massaging and stretching out their backs on the floor. So things like that are preventative measures that you can do to prevent needing that chronic pain. And the lower back pain is the most common chronic injury that people have.
For loved ones of those who may be at risk for being addicted to opioids, what should they be looking for?
You're looking at withdrawal from their social life or change in their behavior. You're looking at isolation. And what you can do is love them. And I know that sounds so almost trite or cliche, but you're looking to say, I will be here for you, I'm going to support you, and not tolerating the bad behavior, but making sure that they get the love and support and possibly the resources that they need. Taking them to the hospital or taking them to a facility that might be able to help them withdraw from the medications or from the opioids itself.
For anybody at home who's listening to this right now and maybe thinking to themselves, I may have a problem, where can they go for help?
Well, you can start with useonlyasdirected.org. And another place is the Division of Substance Abuse and Mental Health, so dsamh.utah.gov.
All right, we have all that information on our website at fox13now.com. Susannah Burt, thank you so much
Thank you so much
for joining us. Good information, a great way to open the conversation.
Thank you.
Thank you.